एक बार आप लगाया रखो इसे, मुझे समझ में नहीं आ रहा बहुत सारी चीजें, अभी बोले नहीं ना।
Meeting is called to order.
A very good evening, everyone. I would first like to request the President to please confirm the minutes of the last meeting.
The minutes of the last meeting was circulated, and as we have not received any suggestion or any objection, so I presume that the minutes were confirmed by all of us. Hence, I confirm the minutes of the previous meeting.
Thank you very much. Also, the agenda for the meeting is a talk on the state of organ transplantation in India by Dr. Vatsala Dilip. I would like to take the opportunity of giving her introduction. So I would just like to start out. So Dr. Vatsala Dilip Trivedi, MBBS, MS, General Surgery. She's MCH in Urology. She's a former professor and head of Department of Urology and Transplant Services of LTMGH, Sion Hospital, Mumbai. At present, she is a consultant in urology and transplant services at SL Raheja Hospital, Mumbai and Kohinoor Hospital, Mumbai. She did the first brain-dead kidney transplant in the state of Maharashtra on 27th March 1997. She was felicitated for the same by the then Health Minister, Chief Minister and the Governor. She was the founder and secretary of the Zonal Transplant Coordination Center in Mumbai. She is the president of the National Deceased Donor Network, a national body for promoting organ transplantation. She was invited to WHO Geneva to develop the deceased donor transplantation in developing countries. She was invited to Rajya Sabha for discussion on amendments in Transplantation Act. She was invited to Nepal for initiating Donor Network, a national body deceased donor program in Nepal. She won the Mayor's Award, she's won the Chikitsa Ratna Award, and she was also declared the top 20 women achievers of India. Ma'am, we are very, very happy and honored to have you. It is a very, very brilliant star-studded profile that you have, and we look forward to hearing from you
on
the state of organ transplantation in India.
Before our guest speaker will speak, I would like to mention that we have received a message from our last week's guest speaker, Rotarian Dr. Sunil Keswani, and he sent a message which says, Dr. Vatsala Trivedi is a nice speaker and a pioneer in this field, a very dear friend and a source of inspiration, sent by Rotarian Dr. Sunil Keswani. Now the floor is with you, Dr. Vatsala Trivedi. And one more thing I would like to mention that Dr. Vatsala Trivedi, one moment, Dr. Vatsala Trivedi is working in this field for so many years with vast experience, lots of articles, and she is having her own views, very, very strong views about the NGOs working in this field, because in her opinion, whatsoever is correct should be said correct, and that is a very good quality of her. And today we will listen the just topic which has been given, the state of organ transplantation in India, as well as she will mention about what role the NGO should play. So thank you very much, Dr. Vatsala Trivedi, for joining this. And please, the floor is with you. We expect you to speak for about 15 minutes or so. Then we will have a good question answers for you. Thank you.
Thank you, Mr. Goyal and all for introduction of mine so well. This is one of my, what you say ki is a dear subject. I've been promoting this for more than 25 years. Now, transplantation, as all of you know, has living transplantation and disease donor transplantation. In both, probably the donation is a problem, and the donors are almost unsung heroes in both the process. Now, I'm not going to delve upon much on the living donor, which can be related or unrelated, because it's a vast subject, and I would say the transplantation is one of the greatest miracle of medical science, which made the mankind quite rehabilitation in the life. Now, before I say what is the state, we should know how we went through the journey in India. 1954, probably the Boston did the first living transplant, and after that, the living transplantation became a nice way in all foreign countries. 1971, India started in Vellore, then it went to PGI Chandigarh, and then KEM. Probably initially all were very ethical related transplantation, so-called related transplantation was going on. But India did not have any regulation, though most of the countries did not have. America started around 80s, UK started after 75, etc. So we did not have regulation. In 1994, we had what you say, the greatest gift of government of India for the transplant community and transplant people waiting for the organs. That was Human Organ Transplantation Act 1994. Prior to that, the situation was that there were small nursing homes doing illegal transplant. Bombay was known on BBC as a kidney bazaar, probably. And internationally, India, there was tremendous amount of foreign tourism for the kidney. And kidney was the only organ which could have been transplanted. So as a head of the department, having PGs and other department with me, when I saw this law, I thought it is a greatest boon for so many patients who are otherwise withering in front of AKD. I can develop in a medical college. I can train the second generation for the newer aspect of the transplantation. So we did lot of work, and with lot of effort from 1994 till 97, convincing everybody, getting with me, because it's a teamwork. It is not Dr. Vatsala Trivedi's project at all. It is a teamwork of the medical college. On March 27, 1997, we could do the first successful, ethical, protocolized transplant of the country. It is Maharashtra, what you could awarded me, but it is the first transplant of the country in a medical college. The beauty of it was that there were before, prior to that, Apollo Chennai probably did one transplant, but on table there was a death, so they did not proceed. Everybody was scared of going into, because this was a new zone, probably new jungle. Nobody wanted to enter. Since I was in a medical college, I studied the law book, and we started this transplant. It was not that, one swallow making the summer. We continue to do this in a medical college. There was a progress of the medicine of the transplantation that along with us, even in Mumbai, there were many hospitals got along with me, and we did a lot of transplants. Even Pune joined. Till, as a development of science, I would say, till 2004, it was only kidney from the deceased donor. After 2004, probably the trained team of liver came into India and wanted to start, and the corporate hospital supported them. 2004, 2008, it was kidney as well as a liver transplantation was going. In northern India, most probably it was only living kidney as well as living donor, because deceased donor had not picked up there at all. 2008 onwards, by 2012, the heart transplant became a norm of the life, at least in Mumbai, and the lungs came, pancreas came, and 2015, Cochin did a miracle by doing bilateral composite tissue transplantation, that is both hand transplantation. This made transplantation is an accepted mode of treatment in the so many recipient. Now, as the program, I would say Maharashtra and Mumbai was the first one to set the disease donor program, because one disease donor can give about 8 organs. That time it was only kidney, and we were happy that we could do. But over the time, it would have been a biggest ethical problem. Whom should we give the organ? Tomorrow, some political fellow will say, "This I want the organ." IAS officer will say, cinema actors will say, because Indians get glorified by all of them, and we will miss the road somewhere. And I did study international models like UNOS and all that. And probably Mumbai was the first one, Maharashtra was the first one, government gave a GR, that is government ruling, saying we are also party and you develop a transparent, equitable organ distribution system. So in 1999, with the GR, Bombay started, and that was ZTCC Mumbai. And we developed all kind of protocols, all kind of SOPs, which are in par with the UNOS, UKTS, that is UK Transplant Services, and European Transplant Services, looking into each problem of the transplant, because this is a very tricky thing. Today I feel ki, oh, I got a kidney, I overcame that queue, etc. But over a time, it is a dishonesty to the humanity. So we went on the very scientific way, ethical way. Maharashtra also created this kind of a ZTCC in Pune, Aurangabad, and Nagpur. So by 2004, with cooperation, with involvement, with everybody, with you, Mumbai and Pune could give, in those days where internet was a problem, mobile was a problem, communication was a problem at the initial, 87 donors, which went for the kidney only. Now for the liver, after that it developed. During this time, southern, there were few erratic, or I would say some transplants were occurring, but all were NGO driven. None of them, they had a government structure or government supporting. So 2005, Karnataka was first, which came to me, learned from us ZTCC method, and they started ZCCK, which later on government said Jivan Sartakate, and then it went as a Soto Karnataka. All right. 2007-8 or something, Chennai was, because Chennai had a lot of problem during that time, lot of scams going on during that time. See, NGO supported this kind of a program, NGO supported cannot proceed. There was a lot of irregularity going on. So 2000, I think, I don't remember, 7, 8, I was called, 6 and 7, I was called to Chennai. Then the health secretary sat with me, understood and all that. I think 2008 or 9, they started Transplant, where government was a party to it. Later on, Tamil Nadu, later on, Telangana started. It was AP initially, then Telangana started, and then Kerala started. I did start in West Bengal and Odisha, which is going fairly slowly, not going very fast. These were the state of other state. But, during this time, there were a lot of work was done. There were a lot of deliberations at Rajiv Gandhi Foundation by the expert and administrators, etc. And by 2007, because this was totally NGO driven in all other states except in Maharashtra, but we started a pan-India NGO called NDTN, National Disease Donor Transplantation, supporting each NGO how to work out with their governments, and Pan India giving uniform, because I had seen by then everybody was talking whatever they feel like. So we thought we should give uniform knowledge to the society. So we did NDTN. Under that, we could get a newsletter. Under that, I could get in the MBBS syllabus in MUHS university. That's the only university where undergraduates are taught what is organ donation, what is brain death, etc. Those things we could do it. Same time, I think Government of India, there was a PIL in the High Court, and court had decided, directed Government of India to form amendments. So it was put on the website on public domain. So I did answer. We gave about 10 suggestions, and 2010 I was called on. A lot of deliberation occurred. Out of 10, 8 are taken verbatim in the amendment. They did not accept, though I had an ambition. I thought ki all government hospital, including AIMS, must become a transplant center or should become NTORC, which was not taken. And second thing I thought ki was a long term, because I did not know much of economics, but I kept on pleading them ki under some scheme, either Pradhan Mantri or whatever, you make a transplant fund which any citizen, any NGO can donate and get ATG exemption. So you will have a ready-made fund to give for the retrieval charges or whatever charges you want to give. Otherwise, without the money, nothing can happen. So this should be done. Mrs. Vrinda Karat was in the chair. She said, ki, I doubt these two of yours will go anyway. My reach was only to write. My reach was to go and talk. So I talked and finished. Same time, same year or next year, WHO called me as an Indian representative to develop the disease donor program in India. So there also, I just continued to say we must have a super hospital authority. That is what NATO has won, which can oversee, regulate, help, reach out to the transplant community. So they accepted, probably they gave the recommendation to the government. I had also given the format that it should be reporting to the government, but it should not be a government organization, because it should not be under influence of anybody. This is an humanitarian work and it should be independent, but everything should be reported to the government, Ministry of Health and Welfare. That was accepted. But finally, I don't know what changes occurred over there. So it is today as a NATO, as a government authority. The leap of, I'm talking only disease donation, the leap of disease donation occurred after 2005, because heart people came in. Heart cannot be taken from the living donation. Lung cannot be taken regularly from the living donation. Hands cannot be cut from the living donor. Probably that's why everybody tried, and the corporate hospitals tried. And it was the same time NATO was intervening, helping for the transport or pan-India allocation. As a person in Mumbai, allocating all the norms we had corrected, given, and that was same taken from the NATO. But I had no authority to give the liver to the Chennai or liver to the Hyderabad or liver to the Delhi, which I was totally resisting, say we do not have that authority, it should be at the central government. So that also gave, and probably the best thing happened that time, Indian Society of Intensive Care became very active in understanding what is brain death. So once you have a knowledge, the cooperation increases. So intensive started cooperating. NATO started helping in allocating and probably transporting, though transport is an extremely costly business today also. This is not regularized. I'm not supporting that, but it started. So it went on till 2019. It was slowly the disease donation and organ transplantation was climbing up. Anyway, all of you know 2020, 21, I think 22, Corona ate away the biggest chunk of that period. And 23, we are just limping back. And 24, probably we are going. But this is the time I feel that we should be awakened. We should ask ourselves, have we achieved the goal? Today, Toha 1994 is 30-year-old. Noto is 10-year-old. We claim on a GODT, that is global data, we are second highest across the globe for the transplantation. But our disease donor data is 0.05 to 0.08 only. It has not increased. So isn't it a time that we ask, where are we lacking? NGOs are working, government is working, doctors are working, corporate hospitals are working, but there is something definitely missing in the core, and that's why we are not gone ahead. My basic things to make everybody understand, there are 4 pillars for this program. One is government, second is medical institution, whether private or otherwise, I won't specify, the doctors themselves and the society. Of that, the core support or the core, the गर्भगृह बोलते हैं, भगवान का जो होता है, that is medical institution and the doctor. The government and the society remains only the supporting pillars and not the main pillar. Today, government tells me that you remove your appendix through oral cavity. I will say, no, sir, I will not do that. I know I have learned and I am confident of removing what I have studied. I will do that, So government cannot dictate you do this and do that, and it can give just a direction, nothing more than that. Now, regarding society, I've been telling worldwide, it is told initially also, if there are 10 causes of failure of disease, organ donation and transplantation in India, the 10th is the society. If you enumerate 100, I would say the 100th is the society. Society is never, ever is an edit. He's a hurdle. 1997, even I thought that in our country there are still female feticides are there, dowry deaths are there. Will I be able to talk to the relatives about this? But I have understood and I am confident society anywhere, neither in the south nor in north, maybe still there is a big problem, but neither in east nor in central India, like till Bombay, Gujarat, is a problem at all. Recently, but we like to point out fingers towards others. The doctors say institutions are not helping. Institution says government is not helping. Government is telling our society is not, we are illiterate, so we are not helping. Now, recently, there was Sea Water is an agency, if you all know, Mr. Deshmukh is that. He had done he's a cephalogist. He had done a 30,000 people survey, where they agreed 85% of the people probably did not know what is organ donation. Mostly, my feeling is that he was in a north and a western region only. That's why. If you go in, ask in south and Maharashtra, probably every villager knows today. That is how I'm confident. So, but he said when we talked first time, out of this 85%, more than 98% were ready.
One moment, please.
So the donation is not a problem in educated, non-educated, in not a problem in non-educated.
Sorry, please unmute. Dr. Trivedi, please unmute yourself. Dr. Trivedi, please unmute.
Yeah. So the education level, the economic level, the gender, the poverty is not a barrier to donate organ, provided they are approached in right time, right way. It is not. But we continuously keep on telling the education is poor, the money is poor, so our people are not donating. So I would request Noto, don't go by the perception. You have a data, just analyze. What I'm talking is correct. And if you all analyze, I'm very open. As you said, I have strong views. The educated, the rich, the urban people have lots of doubt in the doctors. They have Google knowledge and they have a lot of doubt about the institution and they dissuade. But if you go to the hospital without much of a knowledge, the wife, the daughter, everybody say, if you approach them and see your honesty, they are ready to donate. This is the fact in India. And all those, India is uneducated, poor is just a hearsay thing that we project and we believe the society is a problematic. Number 2, about the government. Government has given a law. Government has given the amendment. Government has given the noto. But probably I am still very conservative in telling the implementation methods are not correct. The donation is also science. It also is ethics. So we'll have to develop organ donation or disease organ donation. I'm not talking about the transplant. Every surgeon feels great by that. I have gone to Italy, I have gone to France, I have gone to America, and I have learned transplantation. Let me tell you, I have not gone anywhere beyond Sion Hospital, but I have done probably more than anybody a disease donor kidney transplantation, and with the success. So everything is given in the book. But a lot of transplantation survey people come and they say, I have learned. But if they come to India, there are no organs. So over a time, their knowledge also goes down the drain, so it is a vicious cycle. Unless the organ donation is treated by NOTO, by government, by profession, by hospital as a science, it has to be developed scientifically. It is a hospital bound program, and you have to make the hospital stronger than making it as a social event. Today, including NOTO, all NGOs are extremely enthusiastic to work. I have nothing against them. But what is their reach? They can only go to the society. They can say the organ donation, brain death is a accepted mode of death. And after brain death, probably you can donate the organs, and probably you can donate the body wherever it is required. There also, I have reservation. But anyway, whoever is expert, they will opine on that. Beyond that, social worker cannot go. Maybe I would request the social enthusiastic, the social worker and activist should not give the wrong impression, hospital mein gadbad hota hai, udhar doctors must do free. Initially it used to be say, all doctors must work free. Are bhai, kyon? That is their, what you say, bread and butter. I am skilled, I have learned, I am using my skill. What makes you feel that I should do the free thing? And why the social workers have to dictate that you do free? I want to ask all the social workers, you do the social work after you have satisfied your needs. I never asked ki Zaveri ki aap सोने का पैसा नहीं ले लो. I don't say, but that is another biggest problem that I thought that is a problem. The enthusiasm has to be just to spread, learn the thing and spread the knowledge that it is a transparent process, because nobody can interfere. It is done only in the ICU. रास्ते में किसी को आप नहीं मार सकोगे, and घर में किसी को नहीं मार सकोगे. When there is an ICU death, this happens, and all the hospital should be geared off. Now, third thing I would say, government should do, or NOTO should do, every medical college as non-transplant organ retrieval center. Now, please don't dilute here ki every taluka, every place you should have a retrieval center. That is not going to be possible. Why am I saying medical college? Because medical colleges, otherwise also theaters, anesthetists, intensivists, all are there. By this, imperceptibly, you are teaching the next generation of the doctors to be sensitive to the organ donation. In medical college, if there is a brain death, there is a mechanism to the organ retrieval process. But if in a taluka place or a retrieval center, what do you mean by from village somebody will get the body to the retrieval center? That is not going to happen. These are all theoretical and these are all imaginary. And that is what I feel, today there is not a single owner for this program. Everybody owns up the program. Everybody goes and gives the ideas. And people who are not the ground worker, they accept this idea. And it goes haywire. The program has gone into haywire stage. So we have to think and see, if I insist to NMC, insist to Niti Ayoga, they said, yes, madam, this is a very good suggestion, we will give. They will give an advisory. So that way a lot of advisories comes. Yahan kachra nahi feko is an advisory. Who follows? Unless you make arrangement for collecting the thing. So you have to give them the SOP. You have to make them accountable. Then only probably we'll be able to succeed. Every medical college, every doctor, every deans, every CEO are not knowing what is organ donation. There is a program called Donor Action Program. Maybe we can modify, maybe having 2 days CME with them and teaching them, where every level of worker of hospital is required to sensitize. Otherwise, you motivate a donor and aapka liftman goes and tells ki nahi, isme lafda hai, isme nahi jao. and your whole program comes down. So this kind of a teaching that every patient who dies in the hospital must be given a chance to donate by counseling them. This can be tissue, this can be bones, this can be eyes, this can be anything. But in ICU death, probably we do, this should happen. Now, hospital has to be cooperative, and just giving an advisory, I give you in writing, nobody is going to follow because you're not accountable. You have to give a SOP or the way how to do it, and then only you can get out of 10, probably 5 will follow. All right, seeing those 5, next 5 will be following. Now in intensive, second thing, every hospital chief, the deans in the medical college, the CEOs have to be sensitized, because the biggest hurdle today is them. They feel कि इसमें लफड़ा है, कौन जाएगा इसमें? That is one. Medical colleges feel कि we are not getting enough people, we are not getting enough fund, we are not getting people to enthusiastically work, because there are many other restrictions. I'll come to that. So who wants to do this? So nobody wants to cooperate unless they are given a directive and the accountability and necessary facility. Now government expects, or everybody expects, organ retrieval में क्या है? आप organ retrieve कर दो. Every organ retrieval cost, I have costed one even IV set, it comes to, when there is a multi-organ, minimum 75,000 to 1 lakh rupee to that organ center. Now who is going to give? We say कि dead person cannot pay, and a recipient you should do free because he is also poor and all that. Tell me from where this money comes. Then you say कि you have to do CSR. एक बार करेंगे, 2 बार करेंगे. Why everybody should do that charity? And why? Tell me why this charity? So the government, if they are allocating this, Noto told very openly, we have decided to give 50,000 rupees to every retrieval center. So I said, sir, is it for everybody? No, we will give it to government hospitals and the medical colleges. I said, across the India, none of the medical college, none of the government is doing. Whom are you giving? Today it is given to the, done by corporate. I said, why do you distinguish? You make a program or keep a money. So whether it is private, whether it is, say, Mumbai ZTCC succeeded only because I kept that. Whether it is private or either the patient is here also, patient is there also, and we are nobody by constitution to do any distinction. I was very vehement on this, and that's why we succeeded on this. So he said कि नहीं madam, government can give only to the government. अगर government आपका काम ही नहीं करते तो वो कब आप देंगे उनका? So that is what my question was, So the money doesn't come, so the government colleges do not work on that, and this is why it is not happening. Now last, I would say the professionals like me, I was quite passionate, or my era, people had tremendous faith on me, tremendous respect for me. I never saw the danger that doctors are facing today. Every doctor's head, there is a CPA, Consumer Protection Act, hanging. So today, the relative says, yes, aap le lo hai karke. Tomorrow, he goes and puts in a consumer court, you require just 4,000 rupees to put a case. This doctor, मेरे patient मरे नहीं थे, तो भी उन्होंने बोला, और उनका, my father is killed. Maybe that is wrong, but that will be cleared after 10 years. But meanwhile, वो doctor का career तो गया. So, this is a very ironical, And second thing, today, there is a workplace harassment or workplace violence is so high. Some madcap comes and you don't know, you are just walking, somebody stabs you because you have done his father brand and declare किया है. All that, he says कि मुझे गुस्सा आया, लेकिन आपको गुस्सा आया, किसी का जिंदगी गई for doing somebody else. The third draconian law I'm telling you, which has to go to NMC. NMC thought कि doctors are not sincere. Maybe कौवे काले everywhere. किसके profession में काले कौवे नहीं होते? I want to know. So they have made a thing that, every doctor has to put the finger, that is, and a face identity, 9 o'clock in the morning and evening when they are going. Now imagine I'm engaged in the transplant in the night. This is donor transplant occurs in the night. रात भर काम करके घर जाने के टाइम 11 होते हैं सुबह के. Where will I go and put my finger? If I don't put my finger, my pay is cut. So this is also a contradictory draconian law, because you thought doctor लोगों को ऐसे control करने हैं. In this situation, at such this time, there are 1,000+ seats of PG had gone vacant with the 0 percentile. In tomorrow, who is going to become doctor? In usme, how will come to the organ donation and who will go for the transplantation with so many litigation? आपका तो 10 साल of the जिंदगी निकली गई. So these are the contradictory view where government has not thought. The last one I am telling you, government has last one. We say कि 1,60,000 youth die on the road traffic accident, and we must use their organs. I agree. Okay. If they reach and all that, with all that, it becomes a medical legal case when there is a road traffic accident or whatever accident, medical legal case. So even if they donate the organ, today the forensic law or CRPC is such an archival British law, nobody wants to change. Where to change, I do not know. If Rotary feels that they have influence, allow me, help me to change that. So today morning he says, okay, we work out, and by evening we take into theater, we take all the organ and all that, we suture the body, and then we send it to morgue. Once it goes to morgue, the morgue servants do not have any respect for that. They will say, ki body number 7 nikalo, body number 8. These are the ground realities. So the relatives feel what you say, ki very much before that they were treated very nicely, and now their body does not come to him. And by the time postmortem occurs, all the formalities occurs, which goes in the routine tract only. By the time they take home, probably शाम बन जाती है, शाम को दहन क्रिया नहीं होती है, many of the region. So there 2 days of the relatives go and the donor's family is harassed. So the head injury people giving consent has gone down tremendously, at least. And then you get whatever intracranial hemorrhage and all that, and they're old, so you do the marginal treatment and all that. So if you think, I think NOTO or central government has to sit and talk to the ground level workers and then find out what can be done. Now CRPC 173 and 174 has to be changed with the Home Minister. These are the CRPC 1856 law. Why do we continue this? And once you remove all the organs from the body, what do you want for the brain? You had a CT and MRI before only. Why must you have the postmortem? So these are the basic things.
Yes.
Unless you work in the field, you don't come to know. And that's why everybody feels that we can advise, and it goes haywire. In any way, I conclude, transplantation is the God's gift. It's a miracle. Disease donor transplantation definitely will improve the society's health, provided we all go together with one aim, one leader who makes, understands, and others helping it. All of us will reach same place if we hold the hands and not go single one. Thank you very much.
Thank you. The organ donation is a miracle. It's a God's gift, says Dr. Vatsala Trivedi. Thank you very much, Dr. Vatsala Trivedi, for enlightening us all aspects, what is the situation, and being the pioneer in the brain death organ transplant, especially the kidney in India. It's hats off to you. Now, I would just add few things. You mentioned about the transplant centers in all government hospitals. Yes, this is very much required. And if you go to the NOTO site, NOTO has provided that they says, because I had a meeting there in Ministry of Health and Family Welfare, they says that 1.5 crore, they are ready to give the subsidy if any government hospital will start organ transplant. And if there is the government retrieval center, they will give 0.75 crore, means 75 lakhs. But the total budget, if you study for the last 3-4 years or 5 years, they have spent only 2 crores or 2.25 crore or 1.5 crore in 1 year. It means hardly 1 or 2 centers the subsidy has gone. So it clearly shows that, as you rightly said, say eyewash, the money is not reaching unless it will not go to all the government hospitals. And the main aspect is all the road accident, the majority, I can say 99% goes to the government hospital, not going to the private hospital. So unless we will not have the organ transplants or retrieval centers in government hospital. It is not possible whether NGO will work or the doctors will work or anyone will work. Now, secondly, about the money part, which you have said. Earlier, the Ayushman Bharat, the limit is 5 lakhs. It is still 5 lakhs for everyone. But in one of my media conference with Lal Goel, which I used to do earlier during the COVID time, one of the participants is right now the present governor of the West Bengal, Dr. C.V. Anand Bose. He was there, and I raised this thing. I said, you are talking about 5 lakhs rupees. How you expect the liver transplant or heart transplant or even for the kidney, 5 lakhs is sufficient? And in that, he asked me specifically to send the clipping of that, which I sent. And I'm very glad to inform all of our viewers and the members and everyone that our Honorable Prime Minister, Mr. Narendra Modi, is gladly increased the limit for organ donation or a transplant only for in the Ayushman Bharat to 15 lakhs of rupees. So now it is 15 lakhs, although it is not publicized, people are not aware, but it is there. If you want, I can send you the reply in Lok Sabha given by the Minister of Health. Thirdly, you mentioned about the transportation of organs. Yes, it's a very, very big issue. And even I will tell you, the airlines are charging the maximum rate. If the ticket is available for 4,000, they will not give the 4,000. They will charge 16,000, which is the MRP of that. On the 31st of last month, that January, I myself and our charter treasurer Rotarian Ramnath Pradeep, we went to meet the SpiceJet chairman, Mr. Ajay Singh, and we requested him, and he was very happy to say, yes, it is a very noble cause. He says, I will talk to my team and we will see to it that it will be implemented. I said at least one person with the organs should be allowed free of cost, not even minimum rate. And I told him that one seat is the seat, airline seat is the most perishable item. Once the door is locked of the aircraft, it's zero value. So if the availability is there, why you are not giving? So he has read. Thirdly, and the last point which I want to make about the cost. The Rotary Club of Organ Donation International has approached the government of Maharashtra to provide 100 pediatrics organ transplant free of cost, which according to them on average, which includes kidney, liver and heart. Basically, these three are taking place in India right now mainly, is costing about 20 lakhs of rupees. So they says, we are ready. 15 lakhs will be covered under Ayushman Bharat, and this will be up to yellow ration card, which covers up to 5 lakhs rupees yearly income. Not this thing. That is what they says. 15 lakhs they will give. 4 lakhs we are raising from the CSR funds and the big corporates, and 1 lakh means about 1 crore rupees. Rotary Club of Organ Donation International is contributing among themselves or generating from the donors whosoever want to donate. So this program, which we are signing very soon, most likely this month or the next month. And as you rightly said, so many legal things. We have our eminent lawyers, also our members. And I will tell you, our Organ Donation International are having members across the world. So we know what is happening other places. And I would like to put in the next board meeting that we would like person like you as an advisor to our club, so that whatsoever practicalities, so whatsoever things, because you are a pioneer. I know that the ZCC is doing so much work. And that is why if you see in Mumbai, or this part of the India or the South, maximum brain death patients are taking place, the transplant. But if you go to North India, if you see the report, you will find only the living donation is taking place. Why it is taking place, I would not like to comment on the live telecast, but you know and I know. So now, thank you very much. And now over to we are opening the forum for the question answers. Over to you, Secretary Rotarian Ritika Gupta.
Thank you very much. I would want anyone who has questions to please raise their hands and we can take them. Yes, Dr. Sudhir Sharan.
I will request Chairman Mr. Lal that we invite Dr. Trivedi once again in the month of March. She did cut herself very short. We could feel it. She had lots of precious information to share. So in month of March, subject to her availability, we should invite her once again to hear other viewpoints which she had. So this was a comment, Rotarian Ritika. The question is, so many hurdles are unnecessary, and therefore, can some of our members sit down, talk informally to Dr. Trivedi and find out where our club can have an action plan to solve them? So Dr. Trivedi can quickly tell us which hurdles are the biggest.
Dr. Saran, time is short, so I will tell you one thing. I think you have not heard my last comment that I am going to put in the next board meeting, which you are also a member, that if the board agrees, we will take Dr. Trivedi as our advisor of the club, and then we can have a joint meeting, because ours is a club, which is a e-club. So we will again have a board meeting in which we will invite her. We will dedicate that meeting for taking her suggestions. We will tell her, so she will be giving all the suggestions, which will be, and then we can decide. So right now, if we will start again repeating the things, it's not possible. Let her also, because now she knows how we are going and what we are doing. Once she will be as an advisor, then I think, which in the next board meeting we are going to put in the agenda. Okay.
Wonderful.
Okay. Thank you very much. Yes, over to Ritika.
Anyone else would like to ask a question to ma'am? So, Rotarian Kumari Shah says it was a great discussion to enlighten us onto various aspects of organ donation practices, challenges, and modesty with such depth of knowledge. Dr. Vatsala Trivedi, thank you very much.
Yeah, I think Rotarian Ruby Agarwal is asking. Yes.
Yes, please.
First of all, I thank our president, Mr. Goel, to bring such a luminary in this field, and with her past such a long hard work journey into this field that she has done. I really, from all the members on the behalf, I really applaud her hard work into this cause, and it's really, really commendable. So,
what's your question, please?
Yeah, I have a question. There is a confusion between cadaver and a living donor, because in India sometimes they call it as a cadaver, and in abroad there is something different. So just wanted
I think Rotarian Ruby Agarwal, you are confusing. It's a confusion is between cadaver and the brain death. I think Dr. Yes, Dr. Yes, Dr. Trivedi will clarify.
See, the Toha 1994 defined brain death as a death. So that time the prevalent nomenclature was cadaver. 2005 onwards or something, WHO felt it to calling somebody as a cadaver is a derogatory for the disease one. So we call it disease, DECEA, not a disease, but diseased donor. We have to respect him as a donor, and we cannot call it as a cadaver. And that is a derogatory for the donor, and that's why the nomenclature has changed internationally. So that's why probably I keep on saying it is a diseased donor, because I don't say cadaver. When I did transplant, I got the first ever cadaveric transplant, and that's why I was felicitated everywhere. So that time it was known as a cadaver. So now the nomenclature has changed.
Yes, because still the newspapers or the media is reporting cadaver. Even in the hostels, people are mentioning cadaver, which I always say it should be a brain death. Thank you very much. Yes, next question, please.
Thank you.
Anyone else would like to ask a question?
Okay. I think no one is asking the question, or Dr. Monish, you want to ask a question?
Good evening, madam. Thank you for that amazing talk you gave us on. I mean, it has been really something, like you said, you have actually spoken to the state of Maharashtra to imbibe it into the medical education system there. But in the state of Karnataka, ma'am, it is not prevalent still. And the students are giving exams every year. Hundreds and hundreds of students are passing out. I think the state of Karnataka has got highest number of medical seats also. When you actually do the mapping in the country of India, because I myself am a part of a medical college. We're just at the youngest medical college in Mangalore as we speak right now. We're just about 9 years old. 3 batches have passed out. And we are trying to talk to them about, we recently had a session. So I did a small session to the students because I'm a part of the Rotary organization here. And also because our local Jeevan Sarthakate,
Yes.
I think there's a lot of pressure on them to have many people sign on the pledge.
Makes no difference.
Makes no difference. Makes no difference. Yes, but
Makes no difference.
it's just a via media for them to bring a level of awareness. Maybe signing on the pledge.
No.
That's all.
See, you pledge, you give the donor card, yes, you
Yes.
give them the freedom. Today you pledge attached to your what Aadhaar card and pledge, and what difference does it make?
Yes, ma'am. It
Who
doesn't
gives
make
you
any
guarantee
difference.
that you will have a brain death? Number
You will
one.
have a brain death.
And even if you have done everything, next to kin of yours say, I don't want to give it to. So where is the validity of
Yes.
your? It is just again a waste of time, waste of energy, waste of waste. I told very frankly to Noto they don't like, because I tell them very openly. The second thing they have done is that they want to introduce in the secondary school this subject, 9th standard.
Okay.
So I said, why are you wasting time, energy and all that? That child is burdened with so many other information. Jitna bada raksak jaake jata hai, easy going
You're
to
right.
take, easy shape. And how old they will be? 13, 14 years, 9th
Yes,
standard,
ma'am. Young
15
people.
years maximum.
15 years.
Do their signature has any value?
No.
No, madam, if somebody dies in their house, they can give. I said, is it have any value? 14-year, can you sign?
Cannot.
Say, are you actually you are wasting
Yes,
energy?
yes.
You are, because environment bachao, rape, good, HIV, all those information you give, which is probably practical, non-practical. I would not change the history, talk something. All this is okay. Why organ donation to them? Why burden those children?
Yeah, yes.
Non-fruitful exercise.
So,
Similarly,
Dr. Trivedi,
on
what is your opinion? Although time is very less, but what is your opinion about opt-in and opt-out system? Because in India we have a opt-in system which is of no use, while in USA they have the opt-in system, but the data says there that 99% people have accepted the last wish of the deceased, and they have accepted and the donation took place. In Europe and in UK, it is an opt-out system. Your short comment on that.
Europe, UK have a legislation, but even today they utilize the only method of convincing the families to get.
Correct.
India is such a vast culturally. एक छोटे से चीज के लिए you keep on fighting and there is strike and all that. You make it opt out. Even if you make opt out, I give you today in writing in what it will never function, because no doctor will enter into that arena at all. You cannot say कि no, आप स्टेट ने बोला हमें आपका organs ले सकेंगे. Tomorrow morning there will be strike and you go one step ahead, you come back 10 steps. It makes no difference. Just to know what is opt-in and opt-out, I am totally against for propagating opt-out and starting a new controversy and sitting there only or going back 10 steps in the organ donation process. Let it be opt-in. You keep the correct steps. Hit the nail only on the head, then only it can go into the wall. If you keep on hitting all around, that nail is never going to the wall at all. And what today we are doing is we are hitting all around, but we are not hitting the nail on the head. We are not correcting the system. That's why it's a system failure.
One more thing, lastly, because no one else is asking question. We have seen that in USA, people are waiting even 5 years or 10 years, and they are getting the kidney from the brain death person. But in India, very few, either they are not surviving or they are managing with a illegal means within 2 or 2.5 years. Why it is so?
Because you have illegal means. Why do you want to wait?
That is
and
one. It is, and that is only for the rich and super rich people, not for the poor people.
I would not know. As you said, कि 15 lakhs Pradhan Mantri से आता है, 5 lakh yellow card के लिए आता है. With 19 lakhs, yellow card person cannot afford heart transplant, neither he can afford liver transplant. Kidney maybe. For what I say, it is not only the transplant kharcha. There is a lifelong immunosuppression, lifelong isolation, lifelong many other rehabilitation have to be done. We have to be realistic. We don't have the insurance to cover. So it will be the rich people who are, see, this question was asked to me in Rajya Sabha. Because everybody, you know, all our politicians, they said all kidneys, that time kidney was, all organs must go to the poor, otherwise rich will take the advantage. I said ki, you say poor घर में जन्म लेना उसका नसीब था. Same way I say rich घर में जन्म लेना उसका भी नसीब था. Patient is patient, suffering is suffering. Neither you nor me nor our constitution allows us to make that differentiation. Hence, we cannot say it has to go to the only poor. It has to go to the deserving person. That has to be the motto.
Okay, thank you very much, Dr. Trivedi, for giving very good and in a detailed answers what has been raised to you. Over to you, Rotarian Ritika Gupta.
Thank you very much, ma'am, for sharing all the information that you had, and we look forward to hearing more. Also, I would now request Rotarian DP Sharma to please come forward and give a vote of thanks.
Please unmute. Rotarian DP. Yeah, please, no, please, you have to unmute. One moment.
Mute कर दिया, हो गया.
Yeah,
Hello.
please go ahead. Yes, go ahead.
Thank you very much, Dr. Vatsala Trivedi, to give a wonderful information regarding donation, organ donation. And our club is very thankful for your suggestions, and we will try to do all the best to comply through government and various agencies. And we want you to come again and again to our club and be advisor to us to give such a good information. So we will do the best for the organ donation in India. Thank you so much.
Thank you very much, Mr. Sharma.